So today is very exciting. We have one of our top plastic surgeons with us. Again, like I mentioned, I am joining you from Tijuana, from our lovely hospital, Azar. This is a private hospital that we've built for patients to enjoy the experience, especially for plastic patients, to come here and enjoy their stay with us. And we have Dr. Lopez right there in a different room with my lovely wife Flora, and they are trying to set themselves up to join. So we've been pretty much every other month, we've been doing our plastic surgery webinar, and it's been very successful, and we're getting more and more traction on this. Let me see. Again, I'm gonna do okay. So I hope everybody hears me okay. This room has, this is actually our conference room in Hospital Azar that I'm joining you from. I hope the echo is not unbearable here and you hear me okay. So basically, as Flora and Dr. Lopez are trying to join, I'm going to go over some introduction and go over our offer for attending this webinar, which you get up to $250 off your surgery package. And this cannot be combined with any other offer. All you have to do is to have a health questionnaire submitted in our website, mexicocosmeticcenter.com, and fill out a health questionnaire and just be attending the webinar to the end. Also, we would release a Zoom poll at one time, and we need you to complete that too. Okay, so basically, we would try to cover as many as the questions that is frequently asked during our presentation, but we would open it up at the end, which is a great opportunity for you guys to ask questions from the surgeon or from myself or Flora about the travel part of the experience, and just a little bit about myself. I'm Flora. Actually, I'm the founder of Mexico Bariatric Center and Mexico Cosmetic Center. We launched MCC in 2013, right after we started MBC in 2012. We've been very successful in changing people's lives and give them transformation and give them second chance in life. And the cosmetics part has been doing their job by body contouring, post-bariatric patients, and people who need to, skin removal or facelift and other procedures like that. Hospital Azar, as a project, I worked end of 21, and we finished in 2024. So that's a little bit about myself. Flora is my wife, that she is actually running the MCC group, and she works with the coordinator. She works with the surgeons here, make sure that this is a seamless experience as far as your approval. From when you come here, you get a seamless experience all the way. Actually, she's sitting here right with me. You want to say hi?
Hello, how are you guys? I'm Flora. Right.
Okay, so now after this, we would I'm showing you some of our staff. We have Tiffany has been with us quite a bit. She is actually our past bariatric patient, and Kelly, which is our past bariatric and plastic patient. Yeah, so these are the people who are day in, day out working with between you, of course, with direction from Flora and contacting the surgeon on your behalf and getting your approvals, getting consulting what's the best option for you. Hospital Azar is a new hospital, as I mentioned. We offering very exciting and new procedures. We started doing Botox and fillers and skincare now. Constantly we offering new bariatric procedure, weight loss procedures, like we just started doing sassy, and we've been adding all the other minimally invasive procedures like gynecology, endometriosis, hysterectomy. Another exciting procedures that we've been doing is we've been able to do like a hybrid procedures like sleeve with hysterectomy. So these are really great options that patients can explore by coming to us. We've been doing some combination of some of our plastic procedures with bariatrics as well. And we are opening up to knee and hip replacement also. Soon we will be offering cosmetic dental, but that we're not there yet, so we will talk about that in our next episodes. So just the topics that we're going to cover today is we would talk about MCC a little bit more, about hospital Azar, the patient process, like how does it work to get on the calendar as a patient. All the procedures that we offer, I'm going to have Dr. Lopez cover those. And we would talk about our packages, and which we call all-inclusive packages. And we would talk about why go with MCC. And I would release the Zoom poll, like I mentioned at one time, before we go to Q&A session. That's the exciting part of the whole presentation, which you guys get to actually ask questions specifically. And we would talk about some of the success stories, and we do and trying to keep it under 1.5 hours. So let's move on fast. So one of the misconceptions that we see is people coming and asking for plastic surgery as a way to lose weight. And this is a misconception. You cannot lose weight with plastic surgery. And we do have very high standards of how we qualify patients, because it's best what we're doing, keeping your safety and your well-being in mind. If you look at companies I'm not going to name whether it's in US or Mexico or elsewhere, that they do what patients want to get their money. And they don't look at the long term, or they don't look at their well-being and the risk factors. Well, we're looking into all that when we are actually reviewing your health questionnaire, reviewing your inquiries, and go over it with our surgeons. I see Dr. Lopez just joined us. We do a lot of our past patients skin removal, and one of the criteria for that is you need to have at least 1.5 years out from your bariatric surgery to go for this. I mean, make sure that happens. There is a BMI requirement of also 30. Sometimes we can make exception, but we like to keep that BMI of 30 under control and make sure the patients are qualified that way. Of course, maybe Dr. Lopez would expand on this. If you have lost quite a bit of weight, or of course, as we age, you need skin removal. Of course, people who lose weight, they need more extensive skin removal and doing a body contouring. And these are the surgical options that we offer. Of course, not everyone losing weight needs a procedure, but it does happen a lot of times. So there are so many advantages of going to Tijuana and getting plastic surgery. Of course, bariatrics as well. The expertise that they offer in Mexico is above any standard anywhere in the world. And we do offer multiple procedures in one operation. And we call them, for example, Mommy Makeover, which is very attractive. First of all, you don't have to get the surgery multiple times, and it saves you quite a bit of money. At least 70% you save if you were to do it in your home city. And also, but you have to also remember, again, the safety is first. We try not to put, we don't put patients at risk. We do enough procedures in one operation as long as it's safe for the patient. Another, you see what the all-inclusive package look like, but one of the advantages is we offer the medical tourism insurance, which is MTI, at $199. That covers up to 4 procedures in one operation. And that's a great thing to have. They say it's always better to have it and not use it than not having it and you need it. I mentioned Mexico is becoming the center for bariatrics and plastic surgeries. And we are one of the best companies to go with. We are coordinating everything for you. We make sure the surgery itself goes well. We do all the transportation, hotel reservation, where you stay, where you recover. All that is managed by us. Hey, Dr. Lopez, I see you. You're on mute, so if you want to say hi. Yeah, you are on mute. You have to unmute yourself.
Hello,
Hi.
Hi, Ron. Hi, everyone.
Yeah, so I would have a more introduction for Dr. Lopez later on, but at this point, I'm just going to continue so I can get to the part that he is going to take over. The social media has been a great revolution in our lifetime. but also it comes with caution. You have to see all the videos that you see on Instagram, TikTok, Facebook. You know, check the credibility, because everyone can make this cute video and you know, show that there is a lot going on, but in the back end, there's really no credential, no organization, no support for patients. So these are aspects that you need to consider when you're going through surgery, especially as a medical tourist. MCC has been is a US-based company. We're one of the very only one companies that we actually are US-based. We do the surgeries, of course, in Mexico, but we have an office in Sacramento. Most of the time, I am working and I do this presentation from our office, but this time I happen to be visiting the hospital, and Dr. Lopez was here, so he said, "Hey, let's do one together." Of course, you know, he's just next door in a different room, but we are in the same. We are in the administration offices of Hospital Azar. So MCC, in a way, just like MBC, it's regulating the plastic medical tourism industry in Mexico, and we are setting standards of how the procedure needs to happen, how the whole process needs to happen, what the standards of care, and we are the leader in the industry that dictates what needs to happen for every medical tourist come and go. Our processes is very simple. You fill out the health questionnaire, you put the pictures. Flora is going to go over the how to put your pictures in the HQ. And once we receive that, Flora, Tiffany, Kelly, all those people with our surgeon liaison, of course, will be taking your health questionnaire with your pictures and go directly to the surgeon that is best for you. Of course, every surgeon has a spectrum of services that they offer. They're good at so many things that we know is best for your situation. And then we get back to you and we tell you, okay, this is what, basically you're getting a free consultation with our experienced staff like Flora, Tiffany. Kelly is already a patient. She knows what how it looks like, and they would give you a recommendation. And once you decide you're comfortable with it, you put the deposit and we put you on the calendar. All you have to do is book your flight, finish your paperwork, and you're done. So I will let Flora talk about what's the best way to put your pictures in the health questionnaire so we can do the best consultation for you. You are on mute. Please unmute yourself.
Hello, everyone. Again, I'm here with the doctor sitting here. And as we have mentioned in the past, we want to make sure that when you take a pictures, it would be great without the clothes, right,
Yeah.
doctor?
Yeah.
So actually, it's
important.
great that you want to go ahead and introduce yourself and tell.
Okay.
Actually, it's great to hear from you
Okay,
the best
okay.
way to take pictures. Go ahead.
Okay, it's a pleasure to introduce myself. I'm Dr. Peter Eliud Bapo Lopez. I'm a certified plastic surgeon. So nice to meet you, everyone. We talk about the instruction of the photos. We need to have good photos because sometimes the position and maybe the sides are not the correct. So we can decide the correct treatment for you. So we need the best sites for you. So right now at the presentation, we are showing what the size that you have to take at the photo. So we try to make that maybe not just 1 photo, 2 photos, 3 photos, they are not enough. We need maybe 5 or more photos for the size, the treatment for you.
And then, doctor, you probably want to mention that when they do take the photo, you will be the only one see the pictures.
Yeah.
And you want to make sure, they want to make sure that the picture is clear and they should be really the best
Yeah.
result to
Yeah.
be nude.
Yeah.
Correct, doctor?
Yeah, actually, that's the best.
Yes, and when they do take the picture, they want to show like a lipo. You want to make sure that you don't reach out
Yeah.
because that kind of stretch the
Yeah.
and it shows it won't show as much like how much
As much.
lipo that it needs to require and clear is very
Clear.
important.
The
Correct.
most important thing is clear. Yeah.
Yes. And you know, sometimes you guys want to like just get the tummy and just showing from chest down. That is not good enough.
Yeah.
They should really have the pictures. You guys should have the pictures clear, no clothes on. Better to not have a bra on.
Yeah.
Okay, doctor.
The photos, we need the photos. If you want maybe a body lift, we need maybe dynamic photos. What I mean that you have to sit and take a photo from the front, from the back, from your sides, and also you have to stand up and take another photos. So we compare this kind of sagging skin. We can compare with the change of positions and movement. So that's a point to have many positions and many photos for you.
Perfect. So, no, enough of talking about the pictures now. So you fill up the health questioning, of course, and be very precise, please. So you want to go ahead and also emphasize on that the patient needs to be precise and tell the truth as far as the BMI, right?
Yeah, that's another important thing. The BMI is the most important thing to decide if you are the ideal candidate to get into a surgery. Why? Because if you have the ideal BMI, you're gonna have good results. You're gonna improve all the shape, and also we decrease the risk of the anesthesia, because that's an important thing. Also, if you don't have a good BMI, it can be about healing. So we need to have a good BMI. The correct or the ideal BMI, it has to be below the 30.
30 before
30.
Yes, below the 30. And especially for the sleeve, for bypass,
Yes,
it's very important.
Yeah, important. Yeah. Especially for tummy tuck or the largest surgery, the mommy makeover, the lipos, they are the most important thing.
Okay, and doctor, you
Yeah, this is great because I went back to that slide, emphasizing on BMI and talking about when you have a high BMI, the fat is not really under your skin, and they can only extract so much fat under the skin from lipo. So the fat around the organ is not gonna get affected by plastic surgery. So you have to lose weight.
Yeah.
And then once you to your ideal weight, then you go up after plastic surgery. Back to this continuation. So we did talk about the BMI. One more item that you have to worry about is your hemoglobin level, especially if you have multiple procedures done in one operation. So especially for post-bariatric patient, this is a essential fact to look at. And that's why we recommend you do a blood test a month before you come in and make sure you get that done So we make sure your hemoglobin is up. So Dr. Lopez, what would be an ideal hemoglobin for patients to go?
Yeah. We consider that the post-bariatric patient maybe can have low hemoglobin levels. This is completely normal because of the surgery that they had before. But we need maybe must be 12, maybe 11, but 11 just small procedures. What that kind of procedures? Arm lift, breast lift, but just separate, not together, not doing together these kind of procedures. So we need to have levels over the 13 in order to decide combinate procedures. For example, the liposuction with a tummy tuck or breast lift with a tummy tuck. This kind of patient, because many times the patient has for to do everything in one surgery, but this can be possible. Why? Because of the hemoglobin level. So we need minimum 11 to do small procedures, 13 for combined procedures. So that's a recommendation for your security, for your safety.
And you probably, doctor, want to mention that age is important, correct? And the kind of procedure they have done, for instance, sleeve and bypass is as well
Yeah,
different too, like
Yeah.
as far as how many procedure they needs to get done,
Yeah.
correct?
yeah,
So
that's
you-
correct.
At one point, probably during our presentation, I'm going to ask Dr. Lopez to talk about what's the difference between a regular patient looking for plastic surgery and a post-bariatric patient looking for surgery, but we will cover that. So basically, this is a system that we have. Every patient that come in, of course, our surgeon liaison is looking over all the health questionnaire, but basically we're sitting in the middle, making sure your HQ is reviewed by the right surgeon, the surgeon that is best for you, and we make the recommendations that is best for you, tailored to your case. And our surgeon liaison always watching, of course, for medical reasons, make sure, the medication you're taking, when to stop, when to start, all that is happening properly. But I see a lot of people that joined after I started. You're qualified for a $250 up to $250 off. That cannot be, of course, combined with any other discount offer we have by just attending this webinar. And all you need to do is to have a health questionnaire in our system by going to mexicocosmeticcenter.com. If you already have a HQ, you don't need to resubmit it. We would work after that. After that, all you have to do is there is a Zoom pool that I would release soon, and complete that and watch the webinar to the end. The amount of support you get from us is tremendous. Pre-op, post-op, and you do have different groups, Facebook groups that you can join and actually be in contact with past patients, current patients that are going through the same experience you're going through. And so this is a little video about our hospital, Azar. This hospital is made for medical tourists. What I hear from patients is like they don't feel like this is a hospital. It's not cramped feeling. It's open. You see the outside with all the windows you have in your room. Every room has outside view and you get your private room. Of course, we do have some doubles. And the name of the hospital was a tribute to my mother that actually passed away last year, right after we started the hospital. The hospital is a piece of art and the state of the art as well. This has about over 35,000 square feet of facility, 3 floors, 4 operating rooms, 40 beds, and 6 recovery beds. It has in-house X-ray, in-house lab, and the equipment from sterilization to the OR that we have used in the hospital is the best at the industry at this point. And these are some other pictures from reception to patient's room. We do have a policy now that we just started to let the companions come in. Of course, we only have a recliner for them, so you have option to stay back in Hyatt in our hotel or come with the patient, but that's really up to each patient how they want to manage that. We use Hyatt at this time, one of the best, most in-demand hotels in Tijuana at the present time. I was talking about how the medications play a role. Of course, you do have a pre-op diet that is very simple. It's like 12 hour, well, everybody says 8 hours, but I would do 12 hours of, be fasting. If you're on Ozempic or any GLP-1 medications, please stop at least 3 weeks before surgery. No blood thinner or NSAID 1 week before. Smoking is huge. Before and after, no smoking. And we do have the post-op because once you stay in the hospital, we provide food for you. But it's very important. Your regimen is very important after surgery too. You have to eat light, and take care. Recovery is a huge part of the surgery. We want you to arrive before 12 and leave after 2 p.m. So we have enough time to bring you in, do the pre-ops, get you ready. And also on the way back, we want to make sure we have enough time to get you to your flight. Like I mentioned, your companion can stay. You can also stay on your arrival night to stay in a hospital or hotel. We're giving all that options to you. On the day of the surgery, if you're in the hospital, no problem. We get you ready at the time that your operation is and the surgery starts. Most of the patients can be released in one night of the hospital stay, and that's actually what they do in a lot of plastic surgery centers. But we do offer 2 nights most of the time. This really helps with the healing process and having a nurse around to help you with your bandage, whatever you need, so you have an easier time to recover. If we have a room, we can actually keep you all the way to your departure in the hospital. But again, we have to have enough room in the hospital to do that. And that's actually also another great option that we offer to patients. And they do take advantage of this and they stay, because our packages is not standard, is a standard for each procedure. Based on your number of procedures that you do, we offer you 1 night, first night arrival, 2 nights in the hospital, and then the nights after depends on the procedure you're receiving. So sometimes the patients stay here like 7 nights. And again, we try to keep you as long as we can for your best recovery. Once you're ready to go, you can pretty much, whether if you flew in, fly out, if you drove, just take your car from the San Diego International Airport and fly back home or drive back home. This is a highlight of what Dr. Lopez is going to talk about. But for MBC, we have one of the most advanced and complete array of procedures for weight loss surgery. You cannot find any other company to offer all these, from mini gastric sleeve to gastric sleeve, single incision, gastric sleeve, bypass, mini bypass, DS, all different variation of DS, from SASI, SADI, all that stuff that we're doing. We can do revisional surgeries that no one else can even touch. We do have gastric balloon, ESG, TOR, and again, like I mentioned, we have started doing laparoscopic or open hysterectomy and endometriosis, and some of the times we can combine hysterectomy with gastric sleeve, so you get two hybrid operation in one, procedures in one operation. I also mentioned about knee and hip replacement, and here's the introduction for Dr. Lopez. He is a board-certified plastic surgeon. Not only he's a board-certified plastic surgeon, experienced board-certified plastic, he is experienced in post-bariatric patient. And I'm going to let him talk in a minute to talk about what's the difference between a post-bariatric patient going through the plastic surgery and a just individual who hasn't gone through extreme weight loss. Again, it's a great honor to have him. He comes to Tijuana beginning of every month from Guadalajara, and he is one of the best, most careful surgeons we have. And these are the procedures that he's going to go over, and I'll let Dr. Lopez to take over. And thank you, Dr. Lopez.
Okay, thank you, Ron. Okay, about these procedures that I performed, well, here can be the facelift, the nose job, tummy tuck, the mommy makeover, breast augmentations with implants, breast lift or breast reduction. This could be with implants or without that. Brazilian butt lift, liposuction, the arm lift, thigh lift. There are the kind of procedures that I perform. So they are too important to know about everyone. So let's start with the facelift. The facelift, I make an incision around the hairline, continuing around to here and handy behind it. The liposuction may remove excess of fat and the underlying mass layer to define the gemline. So the excess of skin can be retired. So we try to improve the shape of the middle face. So that's the most important thing of the facelift. So there are two kinds of facelift: the traditional facelift and the deep plane facelift. What's the difference? About this, the traditional facelift is for patients that maybe are not post-bariatric patient. Why? Because the tissues have more strength. But the patient with post-bariatric surgery, they maybe can sagging skin. So we need to perform from the deep plane to outside in order to get the best result. So about this, we improve the jawline, the cheek, and the neck. So they can improve three areas for the face. So that's the difference between the traditional and the plain facelift.
So one thing I want to mention, doctor, please, you mentioned that when they do facelift, the eyes and the eyebrow and stuff, that's not included in.
Yeah. Actually, what I said before, Flora, this include just the mid face.
Mid face,
So
and that's considered as a full facelift,
yeah, the
correct?
full face. Yeah. So the blepharoplasty, the A-line, and the front, they're an extra procedure.
Separate.
Yeah, separate procedures. So we can see some examples for patients, and they look amazing. The results look beautiful. So the another patient is
Yeah, go ahead, next one.
no.
Yeah.
Yeah, it's the same patient, so they are a side picture. So
Before and
we can see the jawline.
Yes.
It's more definite. So that's the point of a facelift. About the rhinoplasty, this is too important to know that there are we can offer two kinds of procedures, the closed and open procedures, but it's gonna depend of your anatomy. Also, if you have maybe one surgery before in your nose, that can change the plan of the procedure that I have to perform. So we need to have a really consultation. A good consultation can be with photos. So that's the most important thing, to have good photos in order to decide what the best procedure for you. So also, Flora, I told you that the TC scan, it's important to see the inside structure in order to decide, okay, this patient needs that and this patient needs that. So that's the difference. So the most important thing about the nose is that it's a personalized, it's so personalized. So it's your nose, it's not another nose. We do different nose.
Everybody has different shape
yeah.
of nose, and everybody's wants a different look, so yes.
So it changed. So this is example. My patient have a jump here, so we can be the 368 change.
Yes.
So it look amazing.
Yes.
So more natural. We always look for the most natural results. So this can be the difference between the patient. So it's another side from the patient. So about the tummy tuck, there are maybe many kinds of tummy tuck. This is a good question for the patient, because maybe the patient think that tummy tuck is just to cut under the belly, and this is all, no? But that's not the point. The point is to improve. It's gonna depend of your sagging skin. So could be maybe a mini tummy tuck. So it could be like the picture you see on your right side. Could be an extend from the line behind, and could be a circular tummy tuck. So it means that it's all of the body, around the body. And floor the lids, that is a combination with a vertical surgery. So this is the difference. It's gonna depend the difference for the patients that have maybe bariatric surgery. I remember that Ron told me that that what's the difference between a post-bariatric patient and a standard patient and a plastic surgery patient. So this is the difference. Maybe in most of the cases of the patients, post-bariatric patient, they're gonna need a circular tummy tuck, extend tummy tuck, and also fleur-de-lis or butterfly tummy tuck. So that's the difference between the patient with maybe they don't lose too many weight before.
Yes, the one that they lose, usually the bariatric patient, because they lost so much weight,
So much
it would
weight.
be considered more
Yeah.
circular or
Oh.
extended.
Or extended. For example, this patient, you can see how is the same skin of the in the front. So it has to be to perform a fleur de lis, because if maybe I decide to make a standard tummy tuck, it's not gonna be a good result. Maybe she's gonna ask for another surgery. So that's not the point. The point is to solve of this area. So that's the point of a good photo. So
Yes.
we need it. So this is another patient. This patient was candidate for a standard tummy tuck. Why? Because of the position of her abdomen, and they don't have too many second skin. She has maybe a little bit, so it could be possible to make that kind of tummy tuck. So we can see also a combined procedure. You can see that it was a breast lift plus a tummy tuck.
Yes.
So it's important to talk about the tummy tuck, that the scar takes 6 or maybe 8 weeks to heal and about 12 months to fade. So we need to be patient, but the result is gonna regain the confidence of the patient. So that's the most important thing.
That's the thing, is
That's
a
the
lot
thing.
of is to be patient and
To be
see the
patient.
difference.
Actually, we call patient because we need patience.
Patient.
That's the reason that
That's
we
good.
call patient. So there are also another point that it's so important, Flora, and I told you always with the patient when they are asking for the surgeries, we need to have obviously to avoid smoking,
Yes.
have a good BMI. We need to don't consume maybe alcohol and things like that. Why? Because they're gonna affect how the scare heals.
And also their diet as well, correct?
Obviously.
Yes.
This is more about the proteins level. So we
Protein.
need a good proteins level.
Right.
Okay, breast augmentation and lift. This is most of the common surgery that the patient has for. Why? Because many women like to look so comfortable with the neckline, the clothes. So maybe with this kind of patient, post-bariatric patient, and also the patient with older, they can get well, the shape of her breast change. So we need to repose to up, yeah, to rub the breast. So
The
we do
lift
that.
is very
Yeah,
important.
the lift is very important.
Because
So
to just do the implant, they would not get the same result,
yeah,
correct?
it's important to do. And another thing that is so important that it's in these pictures, there are many kinds of incision. So I decide what kind of incision when I place, for example, an implant, or when I see the patient, because maybe inside the operation room, maybe everything can change because the internal anatomy can be different what I see and external.
That's very good point that you brought up.
Yeah.
Because that's a very good point that we
So
need
that's
to know.
why we explain to our patient that there are many breast lift incision, lollipop and the anchor, and obviously the circular or donut incision. Okay.
Perfect.
So we see this patient. So she's a post-bariatric patient. So we can see the shape of his breast, of her breast. And right now we help to lift, and also we use silicone implants, and they are look more natural and they are look so good. So that's the point of these kind of procedures.
So in her case, what kind of lifting would you consider that?
And she got anchor
Anchors.
Anchor. Yeah, you can see the horizontal incision, vertical and circular.
vertical.
So the horizontal is high behind the breath. So
Under the breast.
yeah, under. So so it could be. Mhm. Okay, let's talk about the arm lift. Also, is one of the most common surgeries that the patient wants. So this kind of surgery, you can see how improve the arm. So we always ask for the a good level of proteins. In this kind of surgery. Why? Because maybe this is a zone that you have to do many movement. So we need to have a good levels of proteins because it's we are dynamic. So we need to take care of the dynamic of the patient.
Interesting. So it's important to eat very well
Very
with
well
protein.
yeah, in
Especially when it
principle,
comes-
especially with this kind of surgery. So that's why I'm always asked for the protein levels, the albumin.
Oh,
Okay, so we can offer too many kind of arm lift also. We can do a mini arm lift that it's in an axillary part, but just are the candidate, the patient who just have on this part the shaggy skin, but if they have maybe near to this part, to external part, obviously they can get a standard arm
To
lift
the-
or
like
extended.
to the elbow, correct?
Yeah, to the elbows.
So is that considered extended?
Yeah, standard is maybe 4 centimeters behind the elbow, but if we extend over the elbow, or
Oh,
maybe
that's
that's extended arm lift.
I see.
It happened also with the thigh. With the
With
thigh.
the thigh as
yeah.
well. Okay.
This is a patient. She's really happy with results. We can see, and also this patient improved her feel, and she is starting to do exercise. So
Yes.
yeah, she
Oh,
looks
yes.
so beautiful.
So now, did she get extended? I mean,
yeah,
yes,
yeah,
extended
yeah,
because
she
she
get
needed-
extended because she
Okay.
needed. But you look how she
Yes.
changed her.
Oh, absolutely.
Yeah.
Now, did you do lipo on that arm?
Yeah, actually, arm lift combine the cut and liposuctions. That's why the results are like this.
Okay, perfect.
Okay, the same thing. Thigh lift is so important. The levels of proteins. So we do also 3 kinds of thigh lift: the regular, the extended, and extended spiral thigh lift. What it means? Regular, it's maybe just on the first 10 centimeters of
Okay.
the
The
leg.
coronal area.
Yeah, yeah.
Okay.
But if we have to extend to the knee, we call extend thigh lift.
Okay.
And the spiral thigh lift is like the pictures here.
Okay.
This is the kind. This is a combination that horizontal cut and vertical cuts. So that's called like this. Okay.
So these legs, what would you consider as, is it just the thigh lift or is it combo of lipo or anything else?
Yeah, we combine lipo and thigh lift. Why? Because we need to keep a fat deposit that she had. So also we improve with the cut and we
Amazing.
Yeah.
It looks amazing.
Yeah. Okay, that's the point, to combine this kind of procedures.
What a difference.
Yeah, difference.
Yeah,
A really good
patient feels
difference.
so confident
Yeah.
after, yeah, that's great.
Okay, let's talk about Mommy Makeover. This is my favorite surgery, Flora. This kind of surgery combine 3 procedures. First, a tummy tuck, I said how many tummy tuck we can do. Remember the mini, standard, circular, fleur de lis. So this plus a liposuction, plus we can do a BBL. Also, we can improve the shape of the glute. So if we combine also with a breath lift. These three procedures are a mommy makeover, okay? If we add an arm lift, a thigh lift, well, this is gonna be extra, but we have to know that we need good levels of hemoglobin to do this kind of procedure. So, okay.
Well, also the same with mommy makeover, the patient needs to be candidate for it, correct?
Yeah, that's correct. Mhm. Okay, here we have a fashion. I really like to see the face of the patient when they get your surgery. Maybe she in the picture she has 6 months after the surgery, so she looks so
Amazing.
confident.
Yes.
Yeah, so that's the point. Look to get natural look.
Yes.
So they look
Beautiful.
amazing.
Yes.
So we see the before, and maybe this is maybe too many saying skin, maybe on the hips, also on the front. Okay, we can see all the change. Maybe after the surgery, the first day, we can see maybe this is, oh, this is what I want. But after the
Yes.
month, remember, patient,
Yes.
we get that result
And-
that the right
At
well,
least 6 to a year, correct? Dr.
yeah,
Procedure.
yes, yeah.
Because each patient is different.
Yeah,
And you
everyone,
have to do
yeah,
their diet,
yeah.
exercise,
Okay,
you know, what kind of food they eat as far as salty food,
yeah.
plain water. Yes.
Of course, that's the most important thing.
Yeah.
Obviously, we the plastic surgeons do the first part, but the patient have to do the next
Yes.
in order to improve the result. So that's the point of the tummy tuck combined procedures.
Very nice.
Here
Very nice.
another patient. She's a young patient. She's really happy with results
Very
because
beautiful.
she was maybe 2 years that I opened this patient, and she keep her result
Very
like
nice.
this. So she's so happy. This is another kind of patient. The right picture is no post-bariatric patient. So that's his look so teeny.
Very tiny, yes.
Mhm.
Very nice.
Yeah. Okay, Brazilian butt lift. This is an extra surgery that we can add with a liposuction. Remember, always, if we have liposuction, we can add a BBL. Why? Because we need to harvest the fat in order to put into the glute. So obviously, the patient has to know that we want to improve the shape first. If maybe we don't have too much fat, we can make maybe a big
Yes.
BBL. So that's the most important thing. And also we always try to make more natural results. So that's a good point to say to our patients.
And also some patients do not candidate when they are overweight for BBL.
Yeah,
Because
yeah.
they're not going to get a really good result.
That's a good
Yes.
thing. That's a
Yeah.
good thing to talk about, because maybe some patients think that this surgery can be just to improve the glute, but maybe they need a lift. So this
Yes.
is an extra surgery. So that's why I say that this is an extra. extra surgery. Here, this is a
Very nice.
patient,
Very
and she improved the shape because we
Yes.
can look the shape. It was like a triangle,
Yeah.
but now this is more curves.
Very
So
nice.
that's the
Like
thing.
right there, it's
Yeah.
very nice.
And they look natural, actually.
Yes, very natural
Yeah.
looking.
Okay, this is about the scar aftercare. We use this kind of gel in order to improve the healing. So this is a gel and silicone scar tape.
So you do recommend it very much.
Yeah, I'm always recommend that in order to have the best result, because the scar is one thing that the patient always try to hide, but it's normal. It's normal to
Yes.
try to hide that.
Yes.
Why? Because you want to regain your confidence. So
That's
this is
right.
completely normal to don't have this scar.
And you do recommend at least 3 months. correct?
Yeah, at least 3 months. They have to be. And we can use always if you are complete healed. If we have a wound and it's immature, we can use it. We have to wait the correct time to start using.
When is a good time to use that?
It's gonna depend, like we talked about before. It's gonna depend of the patient, but an average could be after 1 month.
1 month.
1 month.
Perfect.
Okay, this is a common question that the patient has for how fast can I return to work after cosmetic surgery? Obviously, it's gonna depend of the surgery. Obviously, this kind of surgery, maybe the tummy tuck and the mommy makeover can be maybe the last surgery to return to work, maybe, but it's gonna depend of the patient. But on average, 2 weeks. Face lift, you can return after 1 or 2 weeks. So we can return obviously to walk, to lift. This is more time that we have to wait.
And then please do mention, doctor, that when the patient do get a facelift, that they need to use
Yeah, the government, yeah.
that, and also sunscreen.
Yeah, actually. Why? Because we can get spots if we don't
Like
use
brown
it. Yeah,
spot,
yeah, brown
because the
spot.
skin is kind of thin.
Yes, it's
Yes.
really thin. It's really thin. We can suffer also, and we can get burns because of the sun. So that's an important thing. Thank you, Flora, for remembering.
Of course.
Oh, the thing that you did, you said.
Yes.
Okay, yeah, exercise after cosmetic surgery. This is important. So we need to wait maybe 3 months before working out, okay? To avoid stretching incision, okay? That's a good thing to know. Like walking is recommended after 1 month, okay? And you can increase the maybe the weight. If you like to lift weights, you can increase, and maybe the full exercise can be done maybe at the 8 weeks.
8 weeks.
8 weeks.
Right.
Yeah.
And also it depends of the kind of surgery.
Yeah, actually, like swimming, like running, like the full of
weight
weight
lifting with the
yeah.
weight, they have to be careful.
Yeah, actually. And this is something new that you have, yeah, that you can have for all the patients, the Botox, fillers, and skincare. That's
Yes.
so important
Yes.
because now it's so on the TikTok and Instagram, this is the new.
Yeah.
So we need to do. You
We
need
do-
to do.
Yes, we do, sir, provide Botox, fillers, and skincare.
Yeah.
For the our patient and also for their companion
Yeah.
as well.
And Botox can be useful for full face, for you can use maybe teeny doses of Botox
Then,
here or
like-
maybe here. So there are many uses that you can do. So don't be afraid to use Botox. That another thing, because many patients say, doctor, I'm feeling afraid for use Botox. Don't worry, it doesn't
It's
happen.
okay. It doesn't
It's okay.
happen.
Yeah.
Yeah,
And
that's
also the
scientific.
fillers can be used to improve the shape of the face. So that's a good thing to do. And the skincare, the salmon pedi RN improve the lightness and the dark eyes. So that's a good thing.
But I usually do tell the patient that they do get a facelift to not use a filler. At least wait, 6 to 8 months.
Yeah, they have to
Because
wait.
then, they have to
The
put
structure-
ginger to clean
Yeah,
up the.
yeah.
So Botox is okay, but filler, I usually
You
tell
have to wait.
patient to wait.
Yeah, yes, actually.
I think this is it.
Tuesday.
Go ahead. put it
Yeah,
on.
so I'm just gonna talk about our what we mentioned, all-inclusive packages. This is a time to talk about what is covered. So of course, the surgical team, the anesthesiologist team, when you go to other companies, they may give you all this breakdown, so they may sound like it's less, but when you actually add up all the hotel nights, hospital nights, pre-op, post-op that we do, all the medications, if you go to hotel, the nurse visit, all that is included from the support from our nutritionist for surgery and liaison. We also provide garments if you need at no charge. We do a hyperbaric chamber for some patients to recover faster and better. That's another services that we provide. We also have what we call medical tourism insurance, in short MTI, which you pay $199 and you have coverage up to $25,000. Of course, only complications, so much each part of the package provides. Like I mentioned, why, when we were talking about why Tijuana is so popular, because you can get multiple procedures in one operation and pay 70% less than what you will pay in US. And as you see, these are like individual procedures that you get done in US. And as you see, we are much lower and much better expertise, and you get to stay longer in the hospital, longer in the hotel. We take care of you much more. And then here are reasons why you want to choose us, right? The team of board certified surgeons that we have at this point, we have 5 team of surgical board certified plastic surgeons that are specifically dealing with post-bariatric patients as well. And each one has a certain expertise that they bring into the picture. And we match you with what's the best option for you. For example, if a surgeon is best and certain type of facelift or certain type of rhinoplasty or the body contouring, tummy tuck, fleur de lis, all that we mentioned, torsoplasty, BBL, all that we know what's the patient look like to match him with what's best for them. And that's a job that Flora and her team does day in, day out. Because of years of experience doing this, they know what to do with each patient. So you getting the best consultation, and you are basically taken care of and protected by the company, the US company, to make sure your travel, your procedure is done in a safe, with peace of mind. Surgeons are one of the most components of the package, of course, and I always compare assistant surgeon or surgeons who, for example, doesn't have the expertise to deal with post-bariatric patients with a pilot, right? A pilot that has 200 hours of flight, you don't want the trust like a pilot that has had 10,000 hours of flight, because when on a normal weather, normal situation, you may not need that experienced surgeon, but believe me, you're putting your life in their hands, and when it comes down to it, you need that experienced surgeon. We offer cash, of course, cashier's check, Zelle, credit card, some FSA, HSA payments we take, and you can do a wire transfer to our bank. So many ways you can pay us, and the payment is due 2 weeks prior to once you put the deposit, the remaining balance is 2 weeks, is due 2 weeks prior to your surgery. If you're making a cashier check or cash, just tell the coordinator, send a picture of it, and we will put it in your file. So when you come here, your payments are done, we would focus just on your procedure, on your patient care, and not worry about all the paperwork that you had to do or all the other stuff. That is not something we want to pay attention. If you need financing at this point, we have super money financing, Medicard, and you can go actually to your bank. If you have good relationship with your bank, those are good places to look for money. SoFi, those are all great. They were asking me, what's the MTI? And medical tourism insurance is something that we offer at a discounted price. So this coverage is covering up to 4 procedures in one operation. And these are the coverage that you will get with this. At this point, I'm going to actually have Kelly, that has been impatiently waiting to talk to you guys about her experience. Kelly, we are very fortunate because we are working with our past patient to take care of our future patients. Kelly is a past bariatric patient that actually did post-bariatric body contouring with us. She looks great. She feels great. Actually, she's gonna share her story, but she came to us first to get plastics. And this is what I'm telling you about the BMI, right? We told her no. We sent her back to NBC. So she ended up getting bariatric surgery and then come back for plastics. And we do see this often. You know, they do plastics with the patient, and then they need a bariatric, so they have to do this 3 times. So they do plastic, they do bariatrics, now they have to go back to do plastics. So Kelly, take over and tell us about your story.
Well, that's me. 4 years ago, like he said, like Ron said, I started off, I made the same phone call, looking for cosmetics, thinking I could get a tummy tuck, a lipo, I didn't know night and day. I was 220, 230 pounds right there. I got denied because my BMI was too high. Started doing my research about bariatrics, had the bariatric surgery, lost 95 pounds. My highest weight was, but like I said, about 230. I wore probably a size 14 at that time. Lost my weight, and within 7 to 8 months, got down to about 135. Then I started looking into the cosmetic side. I ended up 1 year now post-op of Mommy Makeover. I had the muscle repair. I had a tummy tuck. Lipo 360, and a BBL and hip fillers. Amazing. I feel like Flora was talking about, so confident. I'm 52 and I can't never imagine, wearing the clothes I wear or having the confidence I have. It's just been an amazing journey. And then actually, so I went from a size 14 when I actually lost all my weight. I went down to a 6'4", maybe that's with my excessive skin. After my tummy tuck, I'm down to a size 0 or sometimes a size 2, just depending on the clothing. But that's like a miracle. I haven't been that size since before kids in high school. Then I went actually back with my sister as a companion. She's actually 2 months out right now and looks amazing. I saw her yesterday and I just couldn't believe the way she felt and smiled and looked, even how people looked at her. And then actually, when I was down there, I ended up doing another procedure myself. I ended up doing a facial fat transfer. So I actually took lipo from my stomach and put it in my face, and I couldn't be happier with the results. So everything you guys have done for me, thank you. It's been such a journey. And yeah, I would do it over 1,000 times again. It's just like I always say, it's the last piece of the puzzle, icing on the cake. It's been a ride. Yeah. Recommend it 100%.
We
Got the
appreciate
most-
you, and we're again congratulate you for achieving this much success and being part of our team. I mean, we are very fortunate to have our past patients help us every day, day to day. So we're getting to the Q&A part, and let me release the Zoom poll, which I promised to do. Okay, there you go. Okay, there we go. So while we're going over the questions that you guys asking, please go ahead and do the few question poll for me. So let's start here with some of these questions, Dr. Lopez. So we want to question and answer. Let's go see. So they're asking, what is a circular fleur-de-lis tummy tuck? You mentioned that, so will it go all the way around, right? So you want to explain that?
Go ahead.
Yeah. Okay, about the circular plus fleur-de-lis tummy tuck, it's a combined procedure that combine a vertical incision, and also we call like circular because it's from the front part of the abdomen to the butt. So they are like a circle. So we call like circular tummy tuck plus fleur-de-lis because there are combined two procedures here.
So, doctor, you
Yeah,
want to make
so go ahead.
that would be some patient need to get that procedure done?
Yeah, it can be the patient with that wants to improve the butt area. So they can be a combined procedure with a circular.
Because they have a lot of loose skin.
Yeah, loose skin on the back. So we need to lift. So this kind of procedure can lift the glute. So the butt is turn a good shape.
Right.
Yeah, so there is a standard fleur-de-lis which doesn't go 360, and there is a circular. That's a difference.
Yeah.
Can you explain what's the best pre-op and post-op diet? Because we were talking about how important the scar tissue care is. And what about the diet? What would be the best pre-op diet and the post-op diet?
Okay, about the diet, it have to be with many proteins. The proteins are the most important thing about the healing, the post-operative surgery. So we need to increase the proteins level. So that's the base of the diet of this kind of patient. After this, maybe we can consume or eat carbohydrate, but a little
good
bit.
one.
Yeah, a good
Yeah,
one.
a
but
good carb,
a
like
good carbs.
fruits.
Yeah, and fruits and obviously vegetable, but
Yes,
that's the
a
point
lot.
of this diet. But proteins is the most important. You can eat whatever. You can eat
Eggs.
bread, eggs, chicken, pork. It doesn't matter, but it have to be proteins principle.
High protein diet, that's the best
That's
thing
the best thing.
for healing, before and after.
Before
right?
and after.
Yes.
Obviously.
I always tell the patient, please stay away from fried food,
Yeah.
because that return a lot of fluid and
Yeah.
yes, and the
Yeah.
fat, the grease is not good
Yeah,
for healing.
Yeah, this kind of fat can affect the result, because if a patient eat fast food, the bad fat it's accumulate in some areas
I
that
see.
it's gonna be a disaster after the surgery.
Interesting, okay.
They're asking about, Brittany is asking about Dr. Guerrero and his experience with MCC. So remember, MCC has been in existence for a long time. And we have worked with a lot of surgeons. We still have, like I mentioned, 5 team of surgical plastic team that one of them is Dr. Lopez. We again find out what's the best option for each procedure for each surgeon. And Dr. Guerrero is one of our surgeons that we use. Okay, so
Let him do it.
okay. So they're asking if we can do this procedure in Sacramento. This is a medical tourism. You come to Mexico. It is such a great experience. The patients maybe sometimes worry about, well, what is going to look like to go down there. Like I mentioned, the hospital, it doesn't feel like hospital. It's like your home. I spent 4 years with one of the best architect team to build this place, and we made it look like home. It's pleasant. You have a great experience. The drivers are awesome. We've been working with the same team of drivers for 10 years. They're friendly. They make you, relax once you land. They pick you up. So there's so many benefits of coming down here. You get better care most of the time. I was just talking to somebody today. More than 50% of our patients are actually nurses, or they're in the medical industry. So unfortunately, we're not capable of offering this in Sacramento, but Sacramento is where our office is, and I think she actually mentioned she's only 20 minutes away from our office in Sacramento.
Okay.
So yes, they've been talking about recovery house, hotel, hospital. We do, when we have room, we can offer, of course, it would be additional fees to keep you in the hotel, in the hospital all the time of your stay. And that is really beneficial. If you have a companion, I think hotel is better option, maybe. But if you by yourself, definitely consider look from Tiffany Kelly to keep you in the hospital all the time. So they're asking, what's the difference between breast lift and breast augmentation?
Well,
Can you repeat the question,
what is
Ron?
So what's the difference between breast lift and breast augmentation?
Okay, this is a good question. About the breast lift, it's to lift the breast to symmetrize and to keep the shape of the breast. The breast augmentation is just to volumize, to get more volume on your breast. That's all. It's not a lift. It's not lifting. Just it increase the volume of the breast. That's all. That's the difference. So with a breast lift, with maintain asymmetry, we can get a better neckline, but with a breast lift is for with a breast augmentation is for young women principally, because they don't need a lift because of the skin, because of the age, because of the pregnancy. So the ideal candidate for a breast lift plus implants are patients that are post-bariatric and that they have a pregnancy.
So there are several questions about drains. So I want you to say which procedures you actually add drains, and when does it need to come off, and what's the best way to take care of it, and if they went back, how to get it out and all that. So you talk about drains, which procedures gets drained, and how long do they need to keep it?
Okay. Yes. Okay, now I hear you, Ron, about the drain. This is an important thing. The procedures that need a drain are the tummy tuck, the liposuction, and the breast lift, just in special cases, like the contracture or maybe like the implant that gets ruptured or broken. So this is just the kind of surgeries that gonna need a drains. Okay. We place drains in order to have a good healing and not accumulate liquid inside the area. So that's the most important thing to do, of the most important thing about the drains. Don't worry to have drain, because they're gonna help you. Okay.
Dr. Lopez, I have a question. Can you kind of explain, you know how when with the health questionnaires, why we do like phase 1 and phase 2, that you can't have all procedures at once together, what they can and cannot have together? Because a lot of times they want more procedures than they could actually have at one time. So that's why we separate the phases.
Sorry. So you mean that we can get too many procedures on the face at the same time?
No, like earlier how we talked why sometimes you can't do a thigh lift with a tummy tuck with a breast lift and a breast augmentation and arms at one time. It's either like phase 1, phase 2, or maybe phase 3 with bariatric patients.
Okay. Yeah, the post-bariatric patient have to they're gonna have many procedures many times to solve of the thing. So maybe we combine first 2-3 procedures, and after facelift and nose job, after that maybe thigh arm lift. We need to create a strategy in order to have the better result and not expose the patient, the safety patient.
Okay, so
Again, we're doing all that we're doing for your benefit, for your safety, and there could be some surgeons or some companies that they do what you want and they take chances, but those are always risky and they put you in danger. So that's the thing, okay, so we did talk about the drains because there was a lot of questions about drains.
One of the patient asked that she has a tummy tuck, and she said, "How can I get the Botox?" When you arrive, you can talk to Oscar, and he would schedule you with the Botox.
So the credit card has a 5% charge, but cash or check, Zelle, it's there's no extra charge, so you can do any of those. Zelle is a really convenient way, but it's up to you how you want to go about it. So they're asking, is pain medication necessary in the recovery period? So Dr. Lopez,
What was
do they need
Yeah,
to use?
yeah, about the pain medication. This is this is an important thing to have it. Why? Because the patient, when they get the surgery, they have to move, to be dynamic, to walk. So this kind of medication, it have to be in the indications of the post-op. So we need it, obviously. We can skip this kind of medication.
So in other words, you're saying, doctor, that is a good idea to take the pain medication.
Yeah,
So that would help but the patient to move around,
move around.
because you do want the patient move around so they don't get blood clot or any other problem.
Yeah, because if the patient don't move after the surgery, can get thrombosis and thromboembolia. That it's a really bad complication with the patient on the legs. So we need to avoid the thrombus inside the legs. So this is prevent with the walking. If you can walk because you are feeling pain, well, that's the circular that we can broke.
So I have one question for you, doctor.
Yeah.
So if you do not have a pain, you don't recommend, I mean, they don't have to take the pain pill.
Yeah,
Do they?
could, yeah, it could be, but I don't recommend that. Why? Because there's a special pain inside that can be focused. So we need to do it because this kind of medication can improve the edema, the slowing. So it's a combined medication. So we need to take this medication because it's not improve just the pain. Also,
It helps to heal.
It helps to heal.
I see. Okay.
So we usually publish the whole webinar recording on YouTube, and you can ask your coordinator for a link maybe around next week, Monday, not Monday, but Tuesday, Wednesday. Please go ahead and ask your coordinator if you need to watch the recording of the webinar. Okay. Oh, about the hospital room. We have about 3 rooms or 4 rooms in the whole hospital that have double beds. So unless you ask specifically to put in a shared room with your companion, because we see that a lot of the bariatrics come with plastic buddies to come. One gets bariatric, one gets plastics. However, almost all patients get their private room, which has the restroom and shower, and so you're not going to You're not going to share a room with anybody. Actually, I want to ask Kelly, because I've been getting a lot of questions about wedge pillow. I know, Kelly, you're expert in that. Tell us about wedge pillow, bringing a wedge pillow.
Okay, yes, yes, I recommend bringing a pillow, especially if you're getting a BBL done. You are going to need something to make sure that your bottom is not having any pressure. Dr. Lopez could tell you that. I ended up bringing a Bobby pillow, which you could buy on Amazon, and it's, you know, for BBLs if you look them up. And also, I bought another pillow to sit on while I was on the plane that didn't give no pressure on my hips and my BBL as well. And as when I got home, I bought special bedding for me to sleep on for the 8 weeks while I was doing recovery. But yes, do bring a BBL pillow with you. You will need it.
Oh, yeah, one thing about the prices, remember, everyone's procedure is different. Of course, when you combine multiple procedures in one operation, you get a discount. So really, based on the amount of skin we have to remove, based on the number of procedures we have to do, everyone's package is really different. We do take time for every application to go over to see what's best for you, what's our recommendation, and you get a price based on the recommendation. Of course, one thing I need to mention is what we determine initially and you book for is not solid written on the stone. When you come here, when you actually, the surgeon is actually marking you, you can still change things based on the talking with the surgeon, and then you may agree with the surgeon that this is the best procedure for you. Maybe you can add some or subtract some of the procedures that you were initially scheduled for. And we, of course, we adjust all that for you. But so the final plan for your procedure is really determined after your consultation, in-person consultation with the surgeon. That's the final plan. There was one more question that I can. They're asking, do we, Dr. Lopez, do we perform gynecomastia,
Okay.
removal surgery?
Yeah, the gynecomastic. Yeah, it's similar to the women's where we make the breast lift, but the difference between women and male, we make liposuction in this part, and if it's necessary to cut around the areola, we do. So maybe the scar is around the areola if we need it, and we perform a liposuction here on the chest in order to have a good shape of the chest, a male chest actually.
You have to
Okay.
remove
Yeah, and sometimes if the patient we need to remove the gland. So that's why the incision around the areola.
I see.
Yeah.
Okay, so the idea of how many procedures can we offer in one operation, it comes down to how many hours you're going to be under with anesthesia. We don't like to keep patients under for more than 6 hours. That's like our basic rule of thumb. So how much can we do in 6 hours? Then it determines how many procedures you get in one operation. So I know some surgeons keep patients on there for 9 hours and 8 hours, and we don't like that. That's not safe for you. So best is to do enough in in one operation, but not
Yeah.
jeopardize your well-being. And also, like, we don't recommend, for example, having arm lift and a tummy tuck with thigh lift. It's a no. You know, these are, you know, you come back for a thigh lift after you get your arm lift and a tummy tuck. And again, you know, these are all like the best practices that keep you, you know, you're still going to get great results, but it is not going to jeopardize your well-being or put you at risk. There was a patient, I don't know if he answered her question, but so here's the deal. If we didn't cover a question, somehow we skipped it or we did not get to it, please go ahead and reach back out to Kelly, Flora, and Tiffany. Flora's number is 916-224-9611. And Kelly, what's your phone number? You want to
Yes, my phone number is 214-432-7323. And my email address is kelly@mexicocosmetic center@gmail.com.
yeah, so you can always email them at Kelly, Tiffany, and Flora at Mexico Cosmetic Center, and they're always there to help you. Like I said, if we unfortunately, because of lack of time, let me see if I have some that I can still answer. Yeah. Oh.
If there's any questions
They're
I'm not,
asking,
oh, go ahead.
can we do a hip replacement at the same time as tummy tuck? Mommy Makeover? Absolutely not.
Yeah.
Recovery from a hip replacement is a major issue.
Yeah.
Okay, so you need to pay attention to that. Again, if you need hip replacement, knee replacement, you can still reach out to the same team, Tiffany or Kelly or Flora, and we can get your questions answered. Anyways, I really appreciate all of you that you took time to join us in this webinar. Dr. Lopez, we appreciate you. Thank you for your time.
Thank you.
Flora, Kelly, everyone, we see you here in the hospital and we wish the best for you. Goodbye.
Nice to meet you. See ya.
Thank you. Bye-bye.
Thank you guys for having me.
Thank you. Bye.
Thank you.
Okay.